Hi, I'm Dr. Kivett in Santa Rosa, California. My board certifications are in plastic surgery and dermatology, and I've had extensive experience and training in hand surgery. I spent a year after doing many thousand cases already in my basic training with two physicians, one of whom was an orthopedic surgeon and the other was a plastic surgeon who focused exclusively on hand surgery. I'd like to talk today about fingernails and fingertips. It's an aspect that's greatly important. The fingertips are our touch with the world, whether we open a door, touch a piano key, touch a child's cheek. All of these things are direct contact with our worlds. And so they're more prone to injury and disease processes. The fingers carry a great deal of infection on them as well that simply just live there on the fingertips and around the fingernails. And so that's why when washing the fingernails is encouraged, it's simply keeping the basic number of bacteria that we all live with to a lesser number. The area around the fingernail is called the perionychium. Onychium is the Greek word for nail, and peri means around. There's a nail fold on both sides called the lateral nail fold, which is skin where it interfaces with the nail, and then the place at the end of the finger on the skin where it interfaces with the nail is called the proximal nail fold. Some people are in the habit of pushing back what they call the cuticle, which we call the proximal nail fold, in an attempt to make it look more beautiful in a beauty parlor. What they're doing when they do that is to disrupt the natural seal which keeps the nail protected, which keeps the tissues protected underneath, and which protects the bone. Since the bone is directly underneath the nail, with the exclusion of a very thin layer of tissue called the periosteum, which is blood-bearing tissue, which bathes the bone with oxygen. There's a nail plate, which is what everybody calls the nail, but then the nail bed is the soft tissue, that perionychium, periosteum, that will protect the bone. So it's important to know that anatomy. Now, if you slam your finger in a door or hit it with a hammer as you're trying to hit a nail, you may notice a sudden severe pain, which is not usually associated with a fracture. It can be, but more commonly is associated with sudden, intense appearance of a purple, bulging quality to the nail, which is absolutely intolerable. It's called a hematoma, and that is heme meaning blood, homa means collection, and so it's a blood collection. And once a person experiences it, whether there's a break there in the bone or not, it's absolutely intolerable. The person is inconsolable, and whoever feels it must be rushed to an emergency room. And or if you were to just take a paper clip and unfold it and see that the tiny cylindrical end of the paper clip seems to be a circle made of metal, just heat that up in a kitchen stove for just a moment to kill germs, and then just take the end of that and just pierce it gently through the nail, and magically, within just a matter of a couple of seconds, whatever blood is released from underneath that nail will take the pain away. It's remarkable. And people have such great relief that it's not uncommon to recommend that to parents of children or to people who call to the emergency room and say, I can't stand it. This is terrible. And because if you got to the emergency room with the same thing, you simply have that done in the emergency room. And it does the same thing. And the relief is instantaneous almost. Waitresses and people whose hands are in water a lot, say waitresses wiping tables with a wet cloth all the time, will bathe that proximal nail fold and the lateral nail folds with water. And so water can get underneath that space if immersed in that area so frequently, and can infect with a fungus or a yeast. And so it's red and it's swollen, and that's what's called a perionychia. And if people try to squeeze it because they're anticipating pus is going to come out, they're going to have a problem because they're simply driving infection and breaking the seal there even more and driving these things deeper into the surrounding tissues, leading to secondary bacterial infections. And so it's important to realize that if you can dry the hands well with a cloth or a fingertip application of a Q-tip, or use a hair blower for just 10 seconds on an area to evaporate the water away from the fingertips, that helps a lot. I've encouraged patients also who are in those professions where the hands are wet a lot to go ahead and use alcohol pads or just dip the fingers in alcohol for a second to dry the water out of those areas. People who find that they have a long-term infection in those areas also, if they were to go ahead and just dilute in a gallon of water 1 tablespoon of Clorox and soak the fingertips in those once or twice a week, that really helps a great deal as well. Rinsing them, of course, after 10 minutes. There are questions about irregular color in the nails. There's a whole field of study devoted to that. The ones that are most important, particularly, are the ones in which a single thin line of dark color comes out from the proximal nail fold and slowly moves outward toward the end of the nail. Now, because our fingertips are subjected to traumas throughout the day, even minor traumas, and if a person has thin skin or is taking blood thinners, even aspirin or fish oil or other things, the 4 Gs, for example, garlic, ginseng, ginkgo, and ginger, these things are blood thinners. And even people who take ibuprofen will also experience a little bit of blood thinning. And so if they strike their fingernail in a way that they don't even remember, and they have a single small area of color change that quickly exits, meaning over a month and a half or so, from that part of the nail, as the nail inexorably grows outward to where you cut it with a fingernail clipper, there's not usually a problem. But where people have a very narrow area of color change coming out from the proximal nail fold outwardly, and it stays there for a while, then that needs to get looked at by somebody who's familiar with looking at nails, because people can develop moles, like the kind you grow normally on your skin, underneath the proximal nail fold. And those moles can, like any other, convert to mole cell cancer. And it's a slow process frequently, but nevertheless, it's concerning. Because if there's a brown or black or discolored area and it's alone, meaning there's not any other on that nail, then it could represent that there's an irregular mole just underneath the proximal nail fold, which a lot of people call the cuticle. And that may need to have a biopsy, which is easily done with no pain. And so that can be studied. And if there is an irregular mole, then certainly that can be helped a great deal by biopsying it and determining that there's a problem. So if you know someone who has a problem like this, or if you simply want to share it with friends, family, neighbors, please do. If you have comments or questions, please feel free to leave them. Give us a thumbs up. And as always, if you can subscribe to our channel, this will help us provide more educational information to people. Thanks for listening.